Good afternoon and welcome to Should I Stay or Should I Go? Evaluating the cost benefits of in-suite versus specialized apps in the digital patient engagement space. Health System CIO production sponsored by Get Well. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the founder and editor-in-chief of Health System CIO, and I will be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box, and we'll take them later in the program. Just so you see how we're going to spend our time today, first we're going to go about 35 to 40 minutes with our main panel discussion featuring Will Landry, SVP and CIO at Franciscan Missionaries of Our Lady Health System, Michael Ely, CIO at Baptist Health, and Mike Reynolds, SVP for Product Development at Get Well. And then we will have our Q&A. So let's jump right in. Will, we're going to start with you. Can you give us an overview of your organization and your role?
Yeah, so my name is Will Landry. As you mentioned, I'm the Chief Information Officer for the health system. Franciscan Missionaries of Our Lady Health System is a Catholic health system based in Baton Rouge, Louisiana. We have 10 inpatient facilities located in Louisiana and Mississippi. And then we also have about a little under 300 ambulatory clinics across both states. And then we also have, in the last few years, we've expanded our EHR to we're now a Community Connect provider with 6 different inpatient facilities across both states as well too, and that's continuing to grow. So that's a little bit about us.
All right, very good, Michael.
Thanks again for the invite, Anthony. Very similar to Will, just a little bit north of him, Baptist Health within Arkansas, 12 hospitals, about 200 points of ambulatory care throughout the state. About a little bit over $2 billion in annual revenue. Not doing Community Connect within hospitals, but definitely in the ambulatory setting.
Excellent, thank you, Mike.
I'm from Get Well, the industry's leading patient engagement product company. And for the last 25 years, we have been focused on empowering patients to be sort of active participants in our healthcare and not just recipients. And I've had the honor of being at Get Well for 12 years, working on our products and engineering teams, and helped bring a number of our solutions to work at our partner health systems.
All right, very good, Mike. Thank you. All right, Michael, let's start with you. First question. Describe your organization's approach to digital patient engagement and where it fits within your overall IT strategy.
Well, it's pretty interesting with an organization. This is the first year that it has been identified as one of the top 6 strategic initiatives enablers of our organization. Usually we're focused around patient access, growth, satisfaction, safety, all those sort of things. But all the way from the CEO, the board, who identified kind of our digital approach and how we're going to engage our consumers, our patients, as a top strategic initiative. And of course, IT is right there's a lifeblood of help drive all of that work. And so we're largely engaging things within Epic to do that. We've been doing that for years, branching more out into remote patient monitoring and using some third-party vendors to do that, to supplement our support of that. But also looking at how we're expanding those capabilities from TVs and with an inpatient setting as well to really engage patients in their care, kind of that future of the hospital, right? The future hospital setting as well. So it's a big strategic focus, again, all the way to our board.
Excellent, very good. Will?
Very similar. I would say that, from a strategic perspective, we've at least the last 5+ years have had a really good foundation of digital tools and digital patient engagement. Obviously, we're an Epic shop like Michael is. So with using my chart and continue expanding upon that and really focusing on standardizing on how we use that across all of our markets, but also with it, whether it's in the room, whether it's AI tech, virtual nursing technologies in the room, or whether it's any point of digital presence with remote patient monitoring or infotainment in the rooms or education in the rooms, or however we reach out to them through patient access as well. It's always part of those strategies, right? So we in the last few years haven't had a digital health or digital patient engagement necessarily strategy. It is always an integral piece of that in our strategic discussions as a health system. So where IT fits in it, we're the ones, obviously, the construction team doing it, right? The implementers of that. We do have a digital health team within the group, but it really touches all areas of technology when you look at it, whether it's, and even looking at ambient listening, right? Because that's a provider tool, but the patient is 50% of that conversation. So and as we've been rolling that out, that's been a game changer too when it comes to digital patient engagement. It's been really that's been really great.
Very good, Mike. What are you hearing from you? Does this sound representative of what you're hearing from your customers, or what are your thoughts?
Yeah, absolutely. I think more than ever, we have the opportunity to bring a wide variety of technology into how we're delivering care and sort of bringing it together in a way that makes sense and is effective and empathetic for the patient is sort of the hardest part of that is how do you actually connect those technologies together in an effective way that is not disorienting or concerning to the patients, the family, and certainly get well sort of with our integrations and our approaches are there to help sort of bring that together into a cohesive experience for our partners.
Mike, tell me, you used the words empathetic and things can be disoriented. That's an interesting way to look at this. I wonder if you think that's important for IT executives to have those concepts in mind. I think it can help you frame up what you're doing with, for and to your patients if you take that approach.
I think whenever you take on a complicated IT project, there are KPIs and goals that you set on the outset. I think it's important that you bring patient and family experience to parity with those other KPIs and goals. We're all trying to deliver care in more efficient ways, more efficient from a staffing perspective, from a technology spend perspective. But if we fail our patients in bringing that technology to the bear, and we don't even understand it sometimes, then I think we didn't do what we could have done in on behalf of the patients and family. So I think even for an IT leader, having those that perspective up front and a plan and a strategy around how you're going to assess the effectiveness of the technology from the perspective of the patient is going to be critical for long-term success.
So let's talk about this a little bit, Michael. Let me go to you. This was a question I was going to ask later in the program, but the idea of having families or patients involved in figuring out your strategy. So you have that sort of governance concept. You could have an inclusion of patients and families in there when you're figuring out your strategy. So a little bit about that, and then also this idea of sort of compassion and empathy. Can that be part of an IT executive's mindset as they go about what they're trying to accomplish?
Yeah, to answer that second part of that question first, I mean, we continuously say, hey, we should make every decision that's reasonable with the mind of the patient first, right? How's this going to impact the patient? And then there's different ways to engage different types of patients, right? And so that has to be taken into account as well. And so, we were talking offhand earlier, Anthony, about, before this started, about our wives are nurses. And so all I have to do is my wife will tell me exactly what's wrong with our digital experience and when she's dealing with it, and we'll take that back to our teams. But we do engage. We had our MyChart optimization steering committee yesterday, actually. And we engage our end users around what's working well for them, what's not. We want to continue to optimize things like fast pass and ticket scheduling, all these things that are very consumer driven to our consumer economy today to make it more efficient and effective for them to receive care. And so we're engaging our own employees, friends, families, neighbors around their experience continuously around that so we can make improvements.
You know, Will, I specifically remember, if I'm not crazy, you talking about getting feedback from friends and family and that being really helpful to you.
Yes.
So this is not inconsequential. I mean, we can have formal groups and advisory boards and committees and all that, but to an IT executive where your family and friends are getting care at your health system, it should not be discounted the value you can get from these anecdotal stories.
Absolutely. I think that and obviously, this I was having deja vu a little bit. I was trying to remember.
Yeah.
This was a similar conversation we've had, and the most candid feedback I'm going to get is from my wife because she's not going to hold anything back. And she already dismisses some of the technology and stuff that I do anyway. So she she really like is gonna, but I think but it's good because she is a patient and our kids are patients of the health system that we go to, and my family and friends are, but they're also patients of some of our competitors are in the market too, and we get to see that as well, and the differences and how that works and what's better and what makes more sense. Because sometimes, like we as technologists, I'm gonna say many times we as technologists think we know better, or we think this is like technically the better way to do it, but it doesn't always work that way for the patient or meet where the patient's at. And I think that goes to Mike's statement earlier about empathy, right? We have to put ourselves or think about where the patients are. And I think that's where the focus groups are really important because there is, and every year that goes on, or every month that goes on, there's an increasing expectation of digital patient engagement, right? Like it is continuing to rise constantly of where the expectations are from our consumers. And so we have to be able to constantly keep improving those systems and making it better for them.
Mike, any more thoughts there?
I was just going to add, Michael mentioned something I think is critical, and that is sort of meeting with a wide variety of patients, right? That an experience of one individual could be massively different from someone else, from a socioeconomic standpoint, from a what conditions that might be barriers to getting care, and so getting that broad perspective, I think is really important, and I think I'm hearing from Michael and Will that that's how they're approaching it. And I think that's the right way to go, especially disadvantaged populations. They are the ones who struggle the most to get care, and they're the ones where care may be less effective as a result of things outside of their control. And so that broad perspective from the outset is going to be really valuable for everyone.
So that's one way to look at getting across spectrum would be, as you mentioned, disadvantaged, but also you could have acuity, right? You could have people that are sort of in and out, or there a couple times, versus someone who's visiting a family member who's there for months. So completely different experiences, and you'll get different feedback. So, right? There's many ways to have different representation there.
Exactly.
I would say absolutely. I agree with that because, and like you mentioned about the acuity, and like what Mike mentioned earlier, sometimes the acuity of the patient, they might be unconscious for long periods of time, and
Hmm.
the digital services that we're presenting are not to the patient; they're to the family members or to the caregivers. So
Yeah, very good. Great point. All right. Now this is where we really get into sort of the core meat, I think, of what we want to cover today. How do you balance the desire for seamless integration with your EHR system against the potential benefits of a specialized solution that addresses specific patient engagement needs? There's so much there that we're going to get into, and the sort of the devil's in the details and the nuances of these decisions. There's sort of real high level stuff we could say, but we're not going to just stop there. So, Michael, I'm going to start with you, sort of high
Sure.
level, and then we'll get into actually making decisions when you have competing objectives, you have competing preferences. Anyway, go ahead.
Yeah, and I think Will echo some of this that I'm about to say, and it's nothing new, but if Epic can do it, that's where we're looking first, right? And so oftentimes it'll get us 85% of the way there, but there are some things that we're focused on as an organization. So like maternal mortality is one of the worst within the state of Arkansas, is one of the worst in the nation around that. And so we have a really honed in focus on improving mother mortality throughout our state and impacting those care deserts within our rural areas. And so we're looking at leveraging and building out some new technology to be supported by caregivers on the background to do that. And it's just so that's not a place where Epic was going to focus at. And so we had to go out and look for those other partners within the industry that can support our needs. So again, yeah, we're weighing if Epic can do it, we're there with them. But where we do need to reach out to other partners, third parties, to meet and to fulfill some of our initiatives, we'll do that.
All right, very good. Will?
Yeah, very similar. We have a very similar governance approach. If Epic can do it, that's where we want to focus. It doesn't mean we're always going to do it that way, but in the end, it's like 95% of the time, or maybe more than that. That's the direction we end up going. Like Michael said, if there's something that Epic isn't doing or they're not focused on, we do look at other systems, but we can be very cautious about like an enterprise scale implementation of something that's separate. Like we might look at some like in specific markets or needs where it is because anytime like because the environment and technology, especially as a lot of these newer AI technologies or the like virtual nursing or like the virtual room stuff technology, it feels like it's rapidly changing. So for some of that stuff outside of that Epic space, we're very quick to do small pilots and small trials, but more cautious on anything, larger than multiple units and things like that, where when it's outside of that Epic framework, because we want to make sure that it is fully integrated in the experience, especially on the patient side. We want to keep everything like contiguous within my chart or like very little stuff outside of that so that the patient isn't having different experience with different systems in our environments.
Yeah, Mike, I'll give you a chance to respond, and then I'll drill down a little more. Mike, what are your thoughts on what you're hearing?
I think it's valuable to make sure you come in with a mindset of not either or. The EHR, Epic especially, sort of occupies such an important role within a health system. It's foundational both to the clinical workflow and to patient experience and patient engagement with the success of MyChart. So I think you take the approach of, is there an opportunity here to go build on the foundation that Epic provides and sort of reach beyond where it's at today? And can we do that in a seamless fashion? And so I think it's sort of important to make sure that as we go out and explore different solutions around digital patient engagement, it isn't just with the mindset of, am I picking Epic or am I picking the solution? It's, hey, is there an opportunity here where the two combined actually achieve outsized results, and even better experience for our patients and families? I think that's just an important perspective to be open to whenever you're going into these important technical decisions. And as Will mentioned, that may have broad impact and you're trying to anticipate where the technology is going. You want to make sure that you're sort of taking that perspective of, can we build something sort of together with the right partners that is foundationed on Epic or the EMR and then grows from there.
Well, tell me when you use the phrase "the two combined," Mike. Like,
Sure.
tell me what you mean by that. I mean, can you be so combined that you're actually almost inside my chart, or is it always going to be a degree of separation?
No, when a health system's building sort of that digital front door and the patient portal, it can be the cornerstone of it. You better be picking vendors and experiences that work within that ecosystem. GetWell, for example, patient experiences are embeddable within MyChart, right? So we're not asking patients to go out into a different digital experience. And our experiences can be embedded seamlessly, so they don't appear to be something separate or strange. And I think that's critical to get that seamless experience. So seamless integration isn't just about ease of implementation and cost. It's also seamless integration into the digital ecosystem that you're building for your patients and family. And so it has to sort of work together. Otherwise, too often end up in sort of a disparate sets of systems competing with each other and lack of clarity. And that's what leads to confusion for patients. Where do I go next? What's my next step? Why does this look and feel different from
So,
the thing
so
that's done
Mike,
before?
we have sort of different levels of integration or right, because we can pick a module that is Epic's that they have, right? So then we're right in there. And to your point, I think we can pick a vendor outside of Epic that's very strongly, deeply integrated with Epic, and the user will not have an experience of logging into two systems. And then beyond that, we can pick a vendor that is not integrated at all and that sits alongside and requires an additional login where there's no integration on the back end and data transferring. So just because you're going with a third party solution and you have chosen not to use, let's say, the in-house, for example, Epic module, does not mean your user will definitely have a disparate or jarring experience. Do I have that right?
No, it certainly wouldn't lead to a disparate experience in and of itself.
Mm-hmm.
But if you pick an Epic foundation, for example, my chart for your patient portal,
Mm-hmm.
vendors who are able to seamlessly integrate into that and build upon that um, can lead to a better experience, a more integrated experience for your patients.
Okay, Michael, I'd like your thoughts there. I mean, this is just
Yeah,
as a high level concept. Tell me, is this kind of how you think of your choices and stuff like
thousand
that?
percent. So that continuity of experience is not only super important for our patients, but it's also important for our clinicians, our doctors, to when they're engaging with their patients about expectations of their ongoing care and how to engage with the health system, right? And so the more complexities that we have, and oh, you have to go and log, we have this other app for you have to work with, and it's not integrated within my chart. It's too disparate and too confusing for everybody. And then the support around that could also be a nightmare. And then there's all sorts of data issues on the back end. So yeah, I mean, we look at it as if it can integrate with an Epic, that's absolutely wonderful. That it could take, I said earlier, if Epic gets you 85% of the way there, these other organizations like GetWell may take you the other 15%
Mm-hmm.
of what you're attempting to do. And
Mm-hmm.
so that integration is key. If that integration is there, that is a serious red mark against you in terms of getting into our organization
If it's not there,
if it's
right?
No.
not there.
Yeah, yeah, yeah. Okay. Um, and we'll go to Michael. Let me stick with you for a second, then we'll go to
Sure.
Will. Michael, talk to me about the difference between the front end and the back end. Can you have a seamless front end where you feel like you're in my chart, but you're actually using another tool like GetWell, but there's issues on the back end? Or can you have them both? Can they all be synced up? Are there
Uh,
different sort of levels of, and then the front end versus back end?
there are, I think if I understand your question, um, on the, yeah, I think there's different, varying levels of support and integration that make it more complex on the back end.
Mm-hmm.
Again, if I'm understanding your question correctly, Anthony, that
I don't even
we
know if
never
I
want the
understand it.
consumer.
Go
What's
ahead.
that?
I don't even know if I understand my question. Maybe you can help me understand my question.
We never want the consumer to have to feel that some of those difficulties in bringing those things together. But yeah, there can be a difference there within that. But yeah, I'm sorry, Anthony. I don't know if I'm answering your question how you're
No,
asking
that's
it.
fine. That's fine. Will, am I making any sense? Let me get your thoughts.
I think I mean, I think you are. I think, right. You don't want, at least from my perspective, we want the experience for them to be seamless. We don't want them to know that it's different systems, right? We do when we have some scenarios like that. We have some scenarios that are different on the front end, specifically for like our provider finder or for scheduling for new patients. We do outside of my chart now. And for the most part, if you were looking really hard, you can figure out that it was different. But for the most part, I think our patients don't know. But we're continuing to refine that over time. That we want it to be like a better long-term experience for them. But as long as they, I think that's our goal. Like, we just don't want it to be different. We don't want
Mhm.
them to have or be looking at something different than, or moving them to different systems, even if the login is seamless, right? Even if you can pass credentials and there's an SSO or whatever, if it's a different look and feel to it, it's a frustrating process for the consumer or for the patient.
Mike, anything else you want to add?
Yeah, I think it's interesting you bring up sort of front end and back end. Certainly from a patient experience and from a patient engagement perspective, that front end, seamless front end experience is important, right? It's sort of a table stakes. You have to work within MyChart and the other digital front doors that the health system has. And I think Michael touched on as well, like the back end data flow, the security around that also needs to be seamless. It can't create cracks in the IT infrastructure. And so I think, Anthony, you're hitting on something where there are sort of two different levels of interoperability, and I think it's wise to think of both in concert.
See, Michael, I think I did make sense on some level. So that's in my defense. All right, I want to drill down on an issue that I find fascinating here, and that I'm sure is interesting as you each describe how it works. You use the phrase, both of you use the phrase, if Epic can do it. Who defines whether or not Epic can do it? Epic may have a tool. You may have IT going, hey, it's in suite. This makes my life easy. This is why we bought Epic. So what do you think, guys? And you may have users who say, nope, we like the outside one better. So who defines, what does it mean that Epic can do it? It may have a module, it may be pretty good, but what if the other one's better? How much better does it have to be in order for it to be selected? There are many, many factors that are going to go into this decision: total cost of ownership. So, okay, if we go with your outside solution, this is what it's going to cost to integrate it. Here are the downsides, all this kind of stuff. That all it's got to get rolled in with user preferences and some sort of metrics maybe around it. Maybe you're saying, hey, from what we could see, it does 85% of what you want. And they're going, no, actually, we'd put that number at 43%. Who the heck is going to decide this? So that's my point, is the devil's in the details. The decisions, I don't think, on the ground are as simple as they might sound. Am I right or am I wrong, Will?
Well, I think you're right. They're not that simple. We have multiple groups within our organization that kind of weigh out these decisions. We have like an IS steering team, which is myself and my IS executives, plus a number of other executives throughout the health system that are looking at and making those decisions. Plus, we also rely on the business units too on the preference, right? Because there are there's many examples, and when I say like 90+% of what we do is Epic, because that's just the bulk of it, right? But there are many examples where we make decisions outside of that. Like specifically like our nursing home EMR, like yes, Epic has a module, but it's like way overkill for us.
Hmm.
Or there might be other areas in the there's other different clinical spaces where we need something really simple, and the Epic module is overkill, or maybe it's not good enough. There's both examples of that, but we do like our IS steering and as our governance for that, and we review that with our with the business units as well.
Michael, the process of
Yeah, it's very similar, and it's 100% operationally led. So we have an executive committee. It actually looks at any changes that we're making within our service line. So we want to do something new, we want to do something different, we want to stop doing something. It kind of goes through this committee that's full of operators, clinicians, and actually that we leverage that committee as our IT governance committee. And so all decisions are driven there around these decisions when we need to make them. Or do we stay with Epic? Do we go with a third party that may be more advanced and specific? What we're finding though is that still some of the integration points are not there, and so we've recently implemented something within our GI space. There's a GI solution out there that's kind of best of breed. We went that route a few years back, and our physicians are really unhappy because they're operating within different systems, right? And so we've really got to evaluate that clinician experience is becoming almost as important because of what's going on within the physician community. But that physician experience is becoming almost as important as any sort of ROI or TCO that we can calculate.
So, Michael, this is fascinating to me, right? Because there's a lot of complexity here. We talk about things being operationally led, but yet IT has to weigh in on things like cybersecurity and integration. As I think you alluded to, you had clinicians select something because that's what they wanted, but down the road, the experience was poor because of integration problems. And unless that is somehow factored into the original decision, with a lot of transparency, because they would need to know why they were being overruled, almost like for your own good, right?
Mm-hmm.
You love this tool, but you don't understand that it's here are the problems
You don't
because we
understand what your
can't
workflows are
integrate
going to
it.
look
Well,
like.
why? Well, fire and HL7 and all these crazy explanations. And they're like, what? You're the IT guy. Can't you just make it work? So tell me
Yeah,
more about that.
yeah, it's just like a light switch, right? No, I mean, I think that that's just a part of it is you're sharing those concerns up front, right? About here's what your experience is going to look like. Here's
Hmm.
the additional costs that we're going to have to do to actually build out additional reporting for you. Here's the additional staff that we're going to have to add because it's a third party system. Whereas we may, if it's an Epic solution, we may be able to absorb that staffing cost, and that all gets built into that. One of the things I am seeing within our contract negotiations is that our terms on these third party systems are much shorter than what they used to be, so
Mm.
that we can try if it's working, great. If it's not, we're able to get out of it quicker and pivot to something else. But that is actually something that's been a little bit more transitionary in the past couple of years as well.
Well, we don't want to overrule our wonderful users, but sometimes the considerations that they may not care about, even if they're told about, meaning total cost of ownership and whatnot. You could have a group of doctors that say, or a department that says, we want this because it's great and we love it and we don't want to use what you want us to use. And you bring in all these factors of these challenges that are organization wide, and they're like, yeah, we don't care. I mean, but maybe the organization has to make a decision that no, this isn't the right way to go, so we're sorry. Do we get to those things? Do those things happen?
We do. It doesn't happen that as our organization, like we've done a really good job of standardizing and having and carrying a message across like our markets that like this is the way, this is the decision. But we're not usually making those decisions unilaterally, right? We have people in the markets and it's I laugh because we're constantly selling, right, on what we're trying to do and how we're trying to do this. And internally selling, right? So whether it's our CNOs or COOs in the markets, and like everyone's kind of gotten on board. And I will say, like to Michael's point, what he talked about, even when it's an operation, like when we're making an operational decision to do something outside of our standard, I'm
Mm-hmm.
usually the one championing it. Like,
Mm.
yes, we need to be, this is the direction we need to go because this is better for the organization, right? Or this is better for operations. Yes, it might cost more money, or yes, we might have to do this, but this is the better and the right decision. I think it's very important, at least, and I'm working with my team on this and having them understand that like IT can't be a roadblock. Like we've got to be help in providing solutions, whether it's the solution we want, which we do get the majority of the time, or if it's not the solution that we want, we sometimes have to acquiesce to that and but then go and support it and champion it with the business to make sure that it's successful.
That's a really interesting and great point. Mike, I want to bring you in here. If you were advising the folks on the panel here and the IT executives at health systems, um, about things that they would want to make sure were considered in these evaluations. So we're making a decision between an in-suite versus a third-party app. Obviously, you are, not an Epic shop, like you're not an Epic, so you would be one on the outside. And if you could say, hey, listen, keep this in mind, and I know you've got self-interest in what you're saying here, but what would you want them to say, hey, don't forget about this? Like, here's a reason to look outside sometimes.
I think it starts from a foundational understanding of what success looks like. And sometimes I think that is educating the stakeholders on sort of clarifying the difference between this sort of is a cool solution or a technology, uh, or are we trying to solve a specific problem, and how do we know if we've succeeded? And sometimes it's easy because it's just sort of metric based. And sometimes it's harder because it might be more experience based or anecdotal. But having that shared understanding and framework with your stakeholders is going to be important as you consider like the different technical paths in front of you. And therefore, sort of you're evaluating the differentiators that a third party might bring to the table in that framework. Sort of the classic is the juice worth the squeeze. A recent example that Get Well has, we're partnering with UMass General up in Massachusetts around SDOH screening and then resourcing, sort of getting resources in the hands of our patients. And they already had a solution in place. They were leveraging Epic and nursing workflows around that capturing the SDOH needs of their patients, every patient who came into the hospital. And they were achieving a certain percentage. I think maybe 40% of patients were being effectively screened, but less so were getting resources. And they set a goal. We want 95% of patients coming through this hospital screened, and we want 95 of those who express a need in certain area, maybe food or housing insecurity, that they're getting resourced in the community and being connected with organizations that can help them address those needs. They had that very clear goal in mind, and they looked at sort of the Epic workflow and what it would take to sort of achieve that goal, leveraging the tools they had in hand in suite. And it was going to actually be a large operational lift to try to hit that number on the back of nursing workflow. We were able to work with them and integrate with the Epic approach, build on top of that, and we are achieving that outcome. 95% of patients are screened. Equally as many that have needs are being resourced. And we knew from the outset what our goal was, and we were able to sort of achieve it. And it allowed us to sort of step back with our partners, both UMass and Epic, and say, great, 1 + 1 is 3 here. We were able to achieve that goal. And we did so with a clear understanding of what success looks like at the end.
All right, very good, Michael. Will said something really interesting. I want to just get your thoughts on when he talked about the fact that often it's Will, that it's the CIO that's promoting the out of suite product, which is really interesting. And you know, as a CIO, we have that high level overall view and sort of that organizational good steward view, which I think sometimes can cause us to be very conservative, um, and perhaps not as innovative as we should be or want to be. Obviously, it's a balance, but innovation's a big word out there, and we don't want to be seen as a CIO as someone who's sort of got that vendor lock-in or vendor capture. So, what are your thoughts around balancing that?
Yeah, I think that's the funnest part of my job is going out there and evaluating the newest capabilities,
Hmm.
the cutting edge, bleeding edge sort of things. And so you'll see myself, our team that are continually evaluating what's going on within the market. Like this past year, with AI being so largely in the face of everything, we were just trying to really push our vendors and understanding their roadmaps, their capabilities, because we wanted to be early market entrants to those type of technologies, whether it be within the cybersecurity realm, within the clinician realm, within the revenue cycle. We're all in that on that, because what that's leading to is efficiencies on the back ends. It's never have enough staff right throughout the organization to take care of patients, to do all the support, and so it's all around how do you get more efficient. And from the CEO to the board to all the other C-suite, they're looking at how can innovation, and innovation is largely driven from an IT perspective, drive those efficiencies throughout the organization.
Very good. Let's talk a little bit about integration. Will, where are we? I guess what we alluded to before was based on the actual application in question, it can be easier or harder to integrate it with your core stack. So, What's that process like? You know, as we go through, let's say a third party application is being requested or is bubbled up to be something a constituency of users wants. We want this, right? Maybe they went to a trade show, whatever. We want this. So it goes through the governance process. As you look at it and do your architecture review, again, it can be more easier or harder to integrate. Where are we with Fire and HL7 and these things, and how hard is it to integrate third parties?
I think it's actually exponentially harder than our vendors make it sound, but it's exponentially easier than my team makes it sound. So
That's
there's
great.
some middle road in there, right? We have every vendor will come in and like, oh, we integrate with Epic or we do this, and it's like they've never really done it before, or that old saying, you've seen one hospital, you've seen one hospital. Like that's the same with an Epic database in the hospital or any of these EHRs in the hospitals, right? We all do things or we move data or we have data in different spots or with our big based on our workflow. So it's not that simple, right? But it's also not as complex as like some of our teams try to make it sound like. Historically we've been very closed off since we went live with Epic on the inpatient side in 2017. We were basically like, it's Epic or nothing. And we've had very few exceptions to that. Well, in the last couple years, I've kind of opened it up some because we have partners in the market that are not going to move to Epic or they're not going to move to our Community Connect model. It's just not going to happen, but it's better for the patient and the provider for us to do these integrations for them to be able to share data. Because I look at these integrations, not just internal, but it's also, I look at it from an interoperability standpoint, right? And I think that, at the end of the day, and even if it's internal systems, the more data that's integrated with the system within the EHR, it's better for the provider and the patient. So it is a tough thing for us to manage. I would say that it always continues to get better. Like the technology is getting better. The third party vendors are getting better at it for sure. But like I said, it's not as easy as they say, and it's not as hard as my team says it is either. So
That's
I've
fantastic.
noticed over like the past 18 months is there's just a swell that happened like during the COVID years. There's just so many new solutions that were hitting the market, like point solutions, right? And Epic in the past, vendor services, they really worked with these third parties to get them integrated. And they had a select few, but now there's so much that Epic just can't keep up. And so their hands-on approach, that are well integrated, but they just can't keep up. And so they provide these playbooks and everything on how to do the APIs and all of that work. But we're starting to see with just so many more within the market that Epic is just not able to support all of them in terms of their level of integration, which has been problematic.
Mike, thoughts?
A lot of thoughts. I live interoperability as head of engineering. I live interoperability and integration on a daily basis, and I think the state of the industry is still a work in progress. As Michael said, there's an enormous amount of innovation happening within healthcare and technology, and I think in AI and other emergent technologies are going to accelerate that to a level and a pace that we've not seen over the last decade or two. And so it will be a tremendous shame if interoperability and integration is the bottleneck that stifles us elevating the level of care, the level of engagement, and the effectiveness of care, because we can't bring into our industry the technology that's expanding everywhere else in our world, in our life. And so it's a work in progress. There's so much more we can do here to make it so uh, when a new technology comes in, that it's more immediately available for evaluation by the market and by the industry. And it doesn't require a tremendous amount of upfront investment to build out those seamless low-cost integrations with the EHR vendors. And then we have to lower the cost of actually executing these integrations on the IT staff of health systems. it's a limiting factor that is ultimately going to hinder our capacity to innovate as we go forward. I think there's so much more opportunity for standards based out of the box integration and authorization and security models that we know exist in other industries. Even in finance, it's very, very straightforward to sort of connect a service to your bank and have access to that, have that financial data flow across in order to take advantage of new solutions and new products. We need something equally low in cost, equally ease of implementation, but at the same time, it perfectly secure and clear what data is being exchanged. It's incumbent on us to do so. And I think, Fire, Smart on Fire, HL7, those are all great foundational technologies, but we haven't evolved yet to the model that leverages those technologies in a way that serves our partner health systems, who are the consumers of the EHR platform and of vendor solutions, to be able to lower that barrier of innovation. And so you hear about all these great technologies, and it's almost tragic if, hey, this solution could really make an impact, but I can't even entertain it right now because I can't afford the level of effort it would take to actually integrate it. So we are in a very rich
Yeah.
in opportunity space here.
You make a ton of sense, Mike, and I completely agree with you that it's a shame that things aren't plug and play because that would really let innovation flourish. So, but there are some challenges there. We're going to do our Ask a Co-panelist because it's so much fun. And Michael, I'm going to let you go first. Do you have a question for one or both of your co-panelists?
Just both, kind of general. Just what are the next generation of patient engagement that either from the vendor side that you're looking at building? I know Mike talked about UMass and up there and Better Will on your side. What's that next generation that you're looking at?
Mike, let's start with you.
The top of mind here at Get Well is um, we have long had sort of differentiated outreach, guidance, navigation platform. And there's a high level of personalization, but sort of actually leveraging that platform in order to sort of support all the different populations that our partners serve. It takes time to sort of set these systems up, to measure them. We want to find a way to sort of accelerate the engagement strategy of a health system to sort of be able to move at a pace that allows us the time and space to serve the needs of very small populations of patients who might have very specific needs or be dealing with a condition or a combination of conditions that, it's not like COPD or something where there's thousands of patients and you can treat that cohort as a whole. But instead, if you have a rare condition, how can we support you and provide patient engagement tools that not only sort of makes it easy to navigate the health system, but is providing personalized, precise engagement and support for you as an individual? How do we extend our reach to be that more precise and personalized down to an individual? And that's going to require a level of technology that is sort of emergent and new. This is how we think of AI as a differentiator, is as a way to actually better understand the individual and therefore provide more precise engagement on the back of that. And so it sort of has this interesting duality, is it allows you to hit a broader scale, more patients being supported by the engagement technologies we bring to bear, but on an individualized basis, it's more precise. It's more tuned to who that person is and their specific needs. That's pretty tough to do if you're doing it just through
Yep.
configuration of a system, right? I'm going to log in and build in rules that says this patient with this diagnosis gets this particular outreach. We need technologies like AI to achieve that level of scale and precision. And that's top of the list in terms of extending Get Well's platform to be a precision engagement platform that is going to support the largest health systems in the industry reach every one of their patients all the time to be a consistent companion.
Awesome, Mike. Thank you. Will, your thoughts?
Yeah, from a like, where do we see, we're doing some interesting things right now with our call centers, like moving to some different call center technologies. Specifically, we're doing some stuff with Google and AWS. And the reason for that is that might not sound that great, but we still in healthcare, we still have a lot of contact by phone. And I know like way more than other industries. Like even within like IT requests, we still get a significant number of requests via phone more than we do like web tickets. And it's just because it's the nature of industry, it's way more personal. People want to touch base. But to counter that argument, one of the things that we're doing, like into what Mike was saying about like the personal or digital personalization, right? We do also see where we're starting to do like direct SMS communication with like kind of AI on the back end, and we're just piloting it. We're alpha testing some of that stuff right now. We're not that far in, but because we know or we've seen we can get better information from our patients, or more better might not be the right word, but more sensitive information from our patients. Specifically, when we were talking about like social determinants of health and things like that earlier, and Mike had brought it up. If we're asking, if they have resource restrictions like transportation or food insecurities or things like that, when we ask them like asynchronously through a device, we get way more honest answers than we do if a provider or a nurse is asking them like directly in the session. And so being able to do more of that digitally, we think we're gonna get better information, and we're gonna be able to take care of those patients better and quicker than we would have in the past. And I think there's been at least in our two states, we know that like our Medicaid and self-pay populations, they almost all have like there is a high percentage of that have digital like mobile devices or handheld devices, more so than our Medicare population. And so being able to communicate and like whether it's through multi-channel SMS and being able to do that with them, I think it's going to be a real differentiator going forward.
All right, listen, I would love to keep going, but we're about out of time. So what I want to do is give everyone an opportunity to make a final point, offer a final piece of advice. There's sort of two issues here where they do come together, but the first issue is that tension between staying in suite and going outside when you feel it's necessary or when your users feel it's necessary, balancing all those issues. The other high level issue is patient engagement at a high level. What are we trying to achieve? What are the strategies? What are the tools and what's coming down the pike? So I'll let you pick either one of those and give some final piece of advice for your colleagues out there who are struggling with these issues. Will, let's go with you first.
I would say from the out of suite, I'll double down on what I said earlier. I think it's inevitable. You have to do it at some point. Like whether it's Epic, Meditech, or whatever you're using, they can't do everything, and they can't do everything wonderfully, right? I mean, there's a lot of them that do a lot of the great things, but there's going to be some solution that's out there that is better, and it's going to make more sense for your organization. And my advice for CIOs is that you own that, and
Yep.
that it's your idea too, right? Because you definitely don't want to or you want to champion that with the business, and
Yep.
you want it to be the right business decision and not a like against IT or outside of an IT decision, because what's right for the business is right for IT as well. I firmly believe that. So
Excellent point, Will. Michael?
I would say whatever you do, design it with the consumer as your point of focus. I mean, healthcare is becoming a commodity to where they will be able to go anywhere to get that. And so the easier that you're able to develop that and meet their needs, the more beneficial to you.
All right, Mike?
I'll piggyback on that and say one of the biggest challenges is you have to anticipate where the consumer expectations are going. Will mentioned sort of taking a look at your call center operations and maybe expanding out to text messaging. I think that's the right direction. It's not just sort of what is the current patient population expect and able to do, it's expand and plan ahead for where patients are going to be in a year from now, 2 years from now, and start to lay the groundwork for a seamless digital experience today.
All right, very good. Well, that's about all we had time for today. Regarding continuing education, you could use the final slide in this deck, and you'll get an email when our automated recording is ready for viewing. If you want to work with us, you can reach out to Nancy Wilcox from our team and go to our website to register for upcoming panels. With that, I want to thank our tremendous panel, Will Landry, Michael Ely, Mike Reynolds, and Get Well for sponsoring. And I want to thank you for attending. And with that, everybody have a wonderful day. Thank you.
Thank you.
Thanks all.